Okay, Assalamu alaikum and good afternoon once again. Welcome to this workshop, which is the 9th workshop in this series. And this is on conducting case-based learning sessions. The plan of the workshop is that we will have an interactive session for, let's say, about 45 minutes or so. And then we would have question answer session before we divide ourselves in, I think, 5 groups, and then we would have hands-on activity. And after that, each group would present their documents and their activity. There would be discussion and followed by reflection. Right, and just please be relaxed and feel free to interrupt anytime when you think that there is something not clear to you. You don't have to wait till the end to ask the question. So it is communication, bilateral communication, and you can ask question at any time. Okay, now coming to this learning outcomes, what we want to achieve from this workshop. First is that the participants will be able to explain the underpinning principles of case-based learning as a teaching learning method. Second, the rationale for using case-based learning as a teaching learning method. Third, the structure of a typical case-based learning session. And then we will be covering about the different approaches or different ways how the case-based learning is conducted. And finally, we hope that by the end of this session, the participants will be able to conduct a CBL session at their own effectively and efficiently. And during that procedure, they would follow the prescribed rules. So these are the 5 learning outcomes which we will, inshallah, achieve during this session. So let's start with first understanding what is a case-based learning session. This is not something new. If you go through the literature, it's more than 100 years ago that something similar to case-based learning was started in University of Edinburgh by Dr. J.L. Smith. The goal of case-based learning is, number one, to prepare students for clinical practice using real clinical cases. There are 2 important words in here. First is to prepare students for clinical practice, number one, but using real clinical cases, which is, for example, not the case in OSCE, where we don't use real clinical cases, we use simulated patients. But in case-based learning sessions, the one particular attribute of case-based learning is that we try to use the real clinical cases. And this is the reason that sometimes our usual case presentation, we can convert that session into a case-based learning session because we are talking about real patients. And I will talk more in detail about this practice. Case-based learning links, excuse me, please mute yourself, please. So,
لك فرق ولا شتا؟ لقيت تنظرتها بشيء فرق شتا؟ مش تبي دكتور لا لوش دكتور نونغا تقولي.
So case-based learning. Excuse me, can everybody mute yourself, please? So case-based learning links theory to practice. That is, this is the session where students apply their theoretical knowledge to a practical situation. And this is done through the application of knowledge to real cases, as we have mentioned earlier. Using inquiry-based teaching learning methods means that students are allowed to ask questions. Being inquiry-based learning, if we look at it carefully, so case-based learning is something in between our traditional lectures, didactic lectures on one side, and the guided learning on the other side. Whereas in traditional, there was one-way communication where teacher is the main person providing the information. On the other hand, guided learning is where the teacher facilitates the students, and that is a student learning, student-centered learning. So CBL falls somewhere in between these two extremes. One side, didactic lecture, and the other side is the student-centered learning. In this context, if you see this definition of teaching, which is a beautiful definition of teaching, that teaching is a process to facilitate learning. And this is the definition which is fully applied in case-based learning sessions, where the process is to facilitate learning rather than didactic teaching. The key elements of case-based learning include a clinical case, a phenomena or a situation. Clinical case, of course, may be more for clinical years, but then for preclinical years, we can talk about certain phenomena or the situation. So number two, we need to provide enough information. Whether it's a clinical case or a situation, we need to provide enough information for students to begin the clinical reasoning process. Thirdly, inquiry by the learners. So we encourage the students to ask the questions, mainly the relevant questions. And fourth, a faculty guiding the discussion and ensuring the learning outcomes are met. So 4 basic elements. There has to be a case, and preferably a real case. Then we need to provide some information about that case, which would make the students to start thinking and clinical reasoning. In the process, students would ask some questions which we need to answer, and along the way, the lecturer has to guide the students and make sure that whatever learning outcomes have been identified, they are met. And therefore, as we are talking about learning outcomes, the stated set of learning objectives with the measured outcome are fundamental elements of modern case-based learning. Means every case-based learning must have its specific learning outcomes. While still on introduction to case-based learning and understanding what it is really, there is no international consensus as to the definition of case-based learning. So the best way to understand case-based learning is to compare it with problem-based learning, and that would clarify many areas related to it without going into the details of the definition. And here is the comparison. Here on the first column, we have the case, the facilitator's role, the student's role, and the resources, and the student's sessions layout. And then we compare the problem-based learning with the case-based learning. If you see, the problem-based learning is learning while understanding the problem. So it's not necessary for students to solve that problem. in problem-based learning, the aim is not to solve the problem, but aim is to understand the problem. And during the process, students would learn different aspects, mainly the basic sciences in relation to that problem. Whereas in case-based learning, the aim is to solve the problem. So students have to apply their previous knowledge to solve that problem. So that is one difference in approach. Second, in PBL, we use the realistic problems, unfold the information over time, and it is truly integrative. So there is high degree of integration in a session on problem-based learning. Whereas in case-based learning, it has to be a real problem or real case, as we discussed earlier. And the information is given over time, or it can be at once. And it is a discipline-based with some degree of integration. So as you see, the PBL is a fully integrated session, whereas the CBL, or case-based learning, is mainly the discipline-based. Coming to the facilitator's role. So facilitator, of course, manages the group. In PBL session, they are not supposed to teach. They are simply there to guide the students to the learning without contributing in teaching. Whereas in case-based learning, of course, the facilitator has to manage the group, but they contribute in teaching, teaches some content, and they can ask questions related to the content to the question. So here, in CBL, the facilitator has a more active role. Coming to students' role in PBL, of course, students are responsible for their learning. They discuss, they ask questions to each other, they read, and they identify resources to find out the answers. And each student in the group is responsible for researching the topic to be covered, mentioned in the triggers. Whereas in case-based learning, of course, students are responsible for learning, but additionally, they are responsible for application of knowledge to solve the case. So they have to apply what they have learned previously to solve the problem at the hand. So of course, they discuss, they ask questions, they read, and each student in the group contributes to the solution of the problem. So here you can see the contrast between problem-based learning and case-based learning. Coming to resources, in PBL, only core resources are given, whereas in case-based learning, a complete list of learning resources is given, and sometimes materials may be provided as well. The sessions layout is that in PBL, there are small groups. They meet 2 to 3 times. And in between these sessions, they study independently or in groups, and it is mainly student-centered. In case-based learning, of course, it is a small group mainly, but sometimes their group can be larger, slightly larger than the usual groups. And there is an independent study, and it is as student-centered as problem-based learning sessions. So although we do not have a strict definition of case-based learning, but when we compare it with problem-based learning session, that gives us a very, very clear picture what a case-based learning session is. The salient features of case-based learning, as I mentioned earlier, number 1, it is a problem-solving exercise. Number 2, application of previously acquired knowledge. And that addresses our common complaint among the clinicians that students know the information, but they do not know how to apply that knowledge in a real life situation. So case-based learning sessions can improve on that aspect. Number 3, learning through peer interactions and lecturers' input. So there is a lot of discussion among the students, and wherever necessary, there would be input by the lecturer. And of course, during this process, they develop clinical reasoning capability and development of decision-making skills, and it promotes deep learning. These are 6 salient features, very important features of case-based learning. I revise very quickly. It's a problem-solving exercise. It is application of previously acquired knowledge. Their learning is between the peers, as well as there is a contribution by the lecturer, and there is a development of clinical reasoning, as well as the decision-making skills. And to achieve those objectives, students have to have a deep learning. Now, that is about the understanding or introduction or the concept of case-based learning. If anybody has any question, we can discuss now about the concept of case-based learning.
Yes, Prof. Have a question.
Yes.
So,
How are you?
yeah, for me, usually, the small group teaching and learning, if you have a large cohort,
Right.
then you require more manpower who are trained in that to be able to deliver. Is there any shortcut to that? Because you said 8 to 10
Right.
per group.
Okay, now there are 2 methods. One is that you can use, like you have an approach in problem-based learning, that you can divide the class into number of sessions, and then of course, as you said, you need more manpower. Other is that we can have those groups within one classroom, like we do, for example, in team-based learning. So all the groups are there in the classroom, and they are sitting on their tables, and they are discussing with each other. And whereas the lecturer is there to guide them and to answer if any question, or if lecturer finds there are something which he needs to ask the student, he can do that. So if there is a sort of problem with the manpower, we can organize in such a way that this can be conducted in one classroom. Does that answer your question?
Yes, Prof. Thank you. I was just thinking about you at MSU. I think you have larger cohort than my group. So how do
Yes.
you deal with that?
Yeah, you can make smaller groups, but in the same venue.
Okay, that's answered the question.
And the students are discussing, each group is discussing on their table while you are there, and maybe you are going from group to group and asking if they have any issues.
Okay, thank you.
Right. Any other questions? Okay, now after understanding the concept, the next question is that why we really need to use case-based learning. What is the rationale? The first thing is that CBL is to provide students with a relevant opportunity to see theory in practice. So whatever they have learned, for example, in preclinical years, now here is an opportunity to see that whatever they have learned, what is the relevance? How that knowledge of physiology, of anatomy, of pathology, of pharmacology, really is applied in real life situations. Number two, CBL is to train students to analyze data in order to reach a conclusion. That is an integral part of a case-based learning where some information would be given to the students, maybe a clinical data, maybe a laboratory data, maybe radiological information, and students have to analyze that information to develop analytic, communicative, and collaborative learning. Yeah. So students have to analyze data and then they have to communicate and they have to work together. So all these skills are developed during case-based learning sessions to connect students with real-life experiences and to provide opportunities for students to put themselves in the decision makers' shoes. That is very, very important that during this session, the students, because this is a safe environment, so that is not going to affect any patient. So in this session or during the discussions, students come up with their own decision and then they discuss and defend and fine-tune in a safe environment. So that is a very, very important reason to use case-based learning sessions. Now, by bringing real-world problems into student learning, case-based learning invites active participation to find out innovative solutions to problems as they work together to reach a judgment, a decision, a recommendation, a prediction, or other concrete outcomes. So bringing a real life situation, real clinical situation into the picture. In their efforts to find solutions and reach decisions through discussion, students sort out factual data, apply analytic tools, articulate issues, reflect on their relevant experiences, and draw conclusions they can relate to new situation. And in the process, they acquire substantive knowledge and develop analytic, collaborative, and communication skills. So that is the real rationale of using case-based learning as one of our teaching learning method. Through case-based learning, students develop a higher order cognition along with clinical reasoning, problem solving, and decision-making skills that often result in a more productive outcomes, justifying the use of case-based learning. Using a case-based approach engages the student. So because this is not simply theoretical session, this is a real patient, a real situation, real data, and that actually creates a lot of interest among the students. So it engages students in discussion of specific scenarios that resemble or typically are real-world example. Imagine 8 or 10 students sitting on the table with a real patient information, and then they are discussing with each other about the diagnosis, about the pathophysiology of signs and symptoms, what investigation need to be done, how to come to a final diagnosis, and how to manage this patient. So we can imagine the intense discussion which can be generated in these sessions among the students, and during that process, they would be learning from each other as well as the resources available there. This method is learner-centered with intense interaction between participants as they build their knowledge and work together as a group to examine the case. Now, the role of instructor in this case is mainly facilitating, but they can have occasional input while students collaboratively analyze and address problems and resolve questions to find the right answer. Now, here I'm sharing some quotes by the students who participated in case-based learning sessions, and they are really, really important quotes and tell us that how students find these sessions useful in their training. Number one, by putting myself in the shoes of various decision makers, I'm rehearsing for my future career. That is one comment by a student. This is not fiction. I know these cases are real. I get a chance to learn firsthand and to practice all kinds of skills I'll need in my job. Another comment, the case solving process has allowed me to develop skills for learning the rest of my life. So these 4 quotes by the students who are participating in case-based learning sessions really give us a wonderful picture, a realistic picture, what the students are going through, what they are feeling, and whether they are satisfied with this process. I have seen firsthand where theory meets the practice. So based on these rationale, which we have discussed just now, if we want to summarize the underpinning principles of case-based learning, they would be, number one, application of theoretical knowledge in real-life situations, student-centered, preparing students for clinical practice, and developing soft and cognitive skills like communication, collaboration, teamwork, clinical reasoning, analytic skills, decision-making skills, owing the responsibility of the decisions and life learning skills. And if you see, these are all so important attributes which we want to see in our graduates. So that justifies the use of case-based learning as teaching learning methods in our undergraduate medical program. Yes, Dr. Imtiaz, please unmute yourself.
Yes, Prof. Just the feedback from student, the few words that you mentioned were all positive. Is there any negative or something that we can uh, input, like, or feedback, or students who could not cope, or
Right.
maybe, yeah.
The negative things would be, and that would be in the beginning, and that would be dealt with very soon. That is, some of the students who feel shy and they are not confident, and they may not take part in the discussion, and they may look up to the other students to provide the information. That is one. On the other hand, I had an interesting experience that a student, a very good student, and with very good performance in the exams, etc., just keeping quiet. And when I inquired, he said that I have learned these things in such a hard way with a lot of work and effort. Why should I share this information so easily? So you can see the 2 aspects, and we need to counsel these students. And the second students, when we counseled that student, that actually by sharing the information, by sharing the knowledge, it helps yourself as well. Because it's not only repeating what you have learned, but it clarifies your own concepts, and you are able to see the other side, how other students think about it. So that are the issues, but these are only in the, let's say, maybe beginning. soon these issues would be resolved as the process goes on. Right? Any other comments by any other person?
Sir, Assalamu alaikum. Can I add to what you have just already said?
Yes, yes, please, Dr. Aisha. Yes.
We regularly take CBL, and we do that in a large group format, and we divide them into their clinical batches in the big hall. And in that, I've seen that some students, the learning outcomes are given to them earlier, and they don't come prepared. And then the quality of the discussion and the time that you have, we have 2 hours for one CBL, and the time also gets wasted. So this is also another problem with CBL, that if the students are not coming prepared according to the learning outcomes that were given to them, then it wastes the time of the whole group.
You see, Dr. Aisha, what is happening in let's say in our institution, we are using it in clinical years mainly, and that is during the posting. So when there are clinical postings, the number of students is relatively small. For example, 4 or 5 postings are going on at the same time. So in for example, our situation, one posting would be around 30 students. So this means that now we are conducting a CBL in a group of 30 students, which is relatively easy to manage. And we use these sessions, I will explain in a short while, mainly during case presentations, where students are ready to present and discuss. So as you are mentioning, that is like more issue in cases of team-based learning, where the students have to prepare the material before coming in. But ideally, in cases of CBL, the students do not have to prepare anything. They do not have to come ready because here to begin with, they have to apply the knowledge which they have already acquired through different sessions, maybe lectures, maybe practical, maybe bedside, maybe self-study. And during that process, when they find there is a gap in their knowledge, so they would use the available resources. So this is not really a precondition in case-based learning sessions, although students have the learning outcomes, but it is not a precondition that they have to really read a lot and come there with preparation. So that is, it's actually different than what we do in team-based learning. Right? Any other comments? Right? Okay. Shall I move? Okay. Yes. Is there any question? Please unmute yourself only when you are going to ask a question. Otherwise, it disturbs other people. Okay, now moving on. So this is about the popularity of case-based learning approach. So 89% of students and 84% of faculty favored case-based learning teaching sessions or methods in University of California. I'm quoting just one study, but there are many other studies showing that this is really one teaching learning method which is liked both by students and the faculty. Okay, now coming to what are the steps how we should really conduct the CBL session. Now we know the concept, what is case-based learning. We know the rationale, the importance, why we really need to use case-based learning. And now is coming to the next stage, that what are the steps for conducting a case-based learning session. And here I have taken the help from this AI, the co-pilot, and see large language model, what is the answer from this. And it describes at the steps. First is the preparation. Second is the introduction. Third is the group work. Fourth is analysis and problem solving exercise are addressing the task. Fifth is presentation and discussion. Sixth is feedback and reflection. Seventh is assessment. And eighth is summing up. So the 8 steps of conducting an effective CBL session. And I'll go into the detail of each step so that we know that how actually we should be conducting a case-based learning session in the classroom. Now, coming to preparation, it is actually a lot of work for the lecturer and for the facilitator to prepare for case-based learning session. Firstly, we have to identify the learning outcomes which must align with the overall curriculum, and we need to define them clearly and what really we want students to learn from the case. We may focus on 1, 2, or more aspects depending upon the case. Maybe in one particular session, we are focusing on diagnostic skills. Another maybe on treatment planning, maybe on ethical consideration. So we can have different sets of learning outcomes for each session. For preclinical, maybe our learning outcomes relate to the comprehension of that particular area. So that is one. So identifying learning outcomes, the focused learning outcomes, and to know clearly that what areas we want to emphasize on. Then we have to select a case based on our learning outcomes, the case scenario, or maybe for preclinical years, as we were talking about the comprehension, we might select the phenomena, maybe physiological or pathological. And of course, that is relevant to the learning outcomes and appropriate for the student's level. Thirdly, now we have to develop material, detailed case material. Let's say if we are going to discuss the case, so patient's history, symptoms, test results, maybe relevant images or videos. So there is a lot of work for a lecturer to prepare for the session, and it has to be a very, very thoughtful approach, very focused approach, and with clear goals to achieve. The tips for this preparation is that sometimes when ideally we have identify the learning outcomes and then select the clinical case, but sometimes it may happen other way around, that we have a good clinical case, and from that case we identify that which areas in this particular case we should bring up for students to learn, but of course they have to tally with the overall curriculum learning outcomes. Then we have to make sure that the learning outcomes are achievable. We cannot be too ambitious. That's why I was saying that we have to be focused in these learning outcomes. Second step is introduction. This is where we introduce the case to the students, provide an overview of the case, and explain the learning outcomes of the session. Share the materials, give students the case materials, like giving the presenting the history, for example, or other. We may share pictures, we may share videos to convey the information. and then identify the task based on the objectives of the session. Learning outcomes are to be achieved, and these learning outcomes may be sort of introduced along the way. So we work on one learning outcome and then move on, and then we work on the second learning outcome, and so on. The third is that once this information has been given, learning outcomes have been explained to the students. So the students start working in a group. So as we were just mentioning, that if a large class, then we have to make smaller groups, preferably in the same situation or same location. But if possible, we might have small groups like we do sometimes in problem-based learning sessions. So then is the assign the roles with each group, who is the leader, who is recording, who is going to present, so that there is active participation from all members. And then facilitate discussion, encourage students to discuss the case and ask questions. The kind of picture I was presenting, that when, let's say, we have a large class maybe, and then we make small groups, but they are in the same location. So students are sitting on their tables, they are discussing, and lecturer is available there to not only to monitor and see how the session is going on, but they are there if any question arises, or they may pose questions themselves as well. So analysis and problem solving. So when these groups are working together, they are encouraged to identify the main issues presented in the case. And now this is what we actually do, is we allow students to access the information, because this is a case-based learning session. This is not an examination. So they are applying their previously acquired knowledge, but they identify that there is a gap, they need some new information. So they discuss with each other, and they may have to look at the literature. So I mean, nowadays it's so easy to get access. So students are allowed to look for information if they need, right? And then they, of course, at the end, they are supposed to develop the solution or to solve that problem. Then is the group presentation. Each group presents their findings and proposed solution to the class. If we have divided into multiple groups, we can, based on the availability of the time, if we have focused on learning outcomes, we might focus on that area. For example, our focus is on management. So the scenario is such that the diagnosis is almost clear. We will ask students to work on the management, and then each group may present, not necessarily coming on the stage, but they may share that how they would manage this situation, and then we discuss about that. Class discussion, as I just mentioned, happens around that. Then is the feedback and reflection. We offer constructive feedback on the students' analysis and presentations, encourage reflection, ask students to reflect on what they learned from the case and how they can apply this knowledge in future clinical scenarios. Assessment is it's not necessary component, but sometimes it may be quite interesting. We can use gamification to, maybe we have some questions, and in my experience, students really enjoy that as a short quiz using this gamification. And the questions are mainly on application, so that can give us an idea that whether students have learned it adequately. And then, of course, we encourage students to assess their own performance and identify the areas for improvement. And the last step is the summing up the session, where the facilitator would summarize the key learning points for the session, clarify any doubts, and they may offer that if some students who want to learn more about this go into the detail, they may suggest some additional resources only for those students who really want to go into more depth of that issue. So here is the, let's say, summarizing the whole process in a small group CBL session. One is that students work together as a group. The group attempts to solve problems using critical thinking. The discussion is student-centered. The discussion allows the students to integrate knowledge gained while exploring the case. The teacher helps facilitate group discussion by asking provocative questions. The teacher helps by correcting the incorrect statements that students may make and by explaining the difficult concepts. And the teacher does not lecture, dominate discussion, or become the focus of group discussion. So I think that is the steps how a case-based learning session can be conducted in very clear steps. Anybody has any question on this, or any ideas, or any reflection on this before we move on to the next step?
Yes, Prof.
Yes, Dr. Imtiaz.
So, yeah, thank you, Prof, for giving the opportunity. I was just thinking about the duration.
Right.
But sometimes, if in some groups or some case-based, you are able to finish it within 2 hours, but sometimes it goes a bit beyond, depending on the complexity and the student interaction.
Right.
May I have your comment? What is the best, duration,
Okay.
optimal one?
In our situation, we have 2-hour session, and the facilitator would look at the case and arrange in such a way that because the learning outcomes are focused, so they try to remain within those boundaries. Because you are absolutely right that if you are not really monitoring and taking care of that, the student discussions may get out of hand, and it may not finish within the time. So we have to be strict on that. And if we find that students are actually going out of the course and they are wandering here and there, we intervene. So we keep on reminding that we have this time only 2 hours, and within that 2 hours, we need to work. This is very, very important issue which you have brought, that if the facilitator is not careful, the session may not finish within the specified time. So and again, as I mentioned earlier, that in our learning outcomes, we don't have to be very ambitious. We have to be realistic that what we can achieve. For example, if it's a complex case and the major issue is in diagnosis, so our main aim would be on the diagnosis, and we would be working on diagnosis. We may not touch too much on management, for example. So we will focus our session based on our learning outcome. I hope that answered your question.
Yes, Prof. Thank you.
Right. Any other questions?
Yes, I have one question, Doctor.
Yes, please.
About the preparation. You said that only the facilitator should prepare. So, since this case is case presentation, about the students. Should they also prepare so that everybody
Right.
will be on board
Okay.
when the case is presented?
Dr. Ahmed, I will come to that. That's very important because when we talk about the different methods, one of them is a case presentation.
Yes.
In that case, the major contribution in preparation is by the students. I'll go into the detail of that. Actually, that is what I'm practicing, and I'm glad you asked that. And I'll share my experience on that.
Thank you.
Thank you. Yes. Any other comments? Okay, let's move on. And that next is the structure of case-based learning sessions. Here I'll give some examples and I'll address the question which Dr. Ahmed has already asked. Let's talk about the preclinical case-based learning first. So 2 sessions within a week or can be on the same day. So 2 sessions. The CBL1 is in the beginning of the week, or maybe in the morning if you want to do on the same day. And the first session can be an interactive session, can be directed self-learning. You can use different methods of teaching. Then the second session, either in the same afternoon or maybe a day later. Now the first session is the whole class. You don't have to divide them into the small groups. It's a whole class session. Mainly we are talking about preclinical. The second is that we divide them into small groups. If you have enough resources, you might use like PBL rooms, but you would need additional staff, or you can have small group session like we do in team-based learning, but in the same venue. Just at the moment, I'm talking about the logistics. So whatever has been taught in the CBL session 1, when we come to the CBL 2, we present a case which is variation what has been taught in the session 1. So it has to be related to session 1, but something different, right? And then together, these 2 sessions cover the set of learning outcome designated for the CBL of the week. It would be very clear when I really give you the example. But what is happening that students have learned something in first session or CBL 1, and then we give a variation that allows students to apply what they have learned in CBL 1. So this is in 2 sessions and specifically for preclinical years. And the learning outcomes would be achieved based on these two sessions. But as I said, this would be clear in just a few minutes when I explain the whole thing. This is just the logistics, and the CBL2 session can be 2 to 3 hours long. Now, there are 3 approaches to conduct a CBL session. One is normal to abnormal approach or mini case method, mainly used for preclinical, can also be used for clinical. Second is modified essay question, which is an interrupted method, means the information is provided sequentially, both for preclinical and clinical. And third is the case presentation, which Dr. Ahmad was just talking, and we will go into the details. So just see these three methods, and I'll give you the examples to clarify that. Normal to abnormal approach, MEQ approach, and the case presentation approach. Now, normal to abnormal approach, Now, let's look at the outcomes of this session. For example, by the end of this session, which would be the second session of CBL, the students will be able to discuss the changes in the hemodynamics of cardiac cycle in acyanotic types of congenital cardiac anomalies. Second, explain the pathogenesis of reversal of shunt or Eisenmenger syndrome in ventricular septal defect. So these are our two learning outcomes. Discuss the changes in the hemodynamics of cardiac cycle in acyanotic types of congenital cardiac anomalies. So you can see our learning outcome is very clear, very crisp, right? Very, very focused. And second, explain the pathogenesis of reversal of shunt in ventricular septal defect. Now, how we go about it? So in first session, we teach the cardiac cycle in normal heart, which may be a whole class session, or you may ask them to learn at their own as well, which would be the DSL. So students learn about the cardiac cycle before in the first session. Now, when they come to the second session, the cardiac cycle in heart with structure abnormality. So we give a situation where is the variation. So we know the normal cardiac cycle. Now we give a situation where a patient has a ventricular septal defect, right? So students now have to apply their knowledge of normal cardiac cycle in a situation where a patient has a ventricular septal defect. And the questions are, what would be the changes in hemodynamics when there is a ventricular septal defect? And in these changes in hemodynamics, what symptoms, signs, and complications may occur? Second, learning issues to be addressed in the same or following teaching learning session. So now you see that in first session, which is normal, we learn the normal cardiac cycle. The second is abnormal, where we give a situation with abnormality in the heart. And now we give students an opportunity to apply their knowledge of cardiac cycle in a patient with VSD. So they have to see that what kind of changes might happen, changes in relation to the volume, changes in relation to the oxygenation, and then they have to think that what could possibly be symptoms and signs when, for example, large blood is going to the lungs, what would happen to the lungs, and what would happen when this blood is returning back. So you can see that how critical thinking would be working in this situation where the students are applying their previously acquired knowledge to this new situation. So this is normal to abnormal approach. Another example is, for example, the regulation of thyroid functions. So this can be a whole class session. We teach about the production of thyroid hormone and their normal regulation feedback mechanism. And then in the second session, we give let's say the first session now is a normal thyroid hormone synthesis with feedback mechanism, as well as the functions of thyroxine. Now we present this situation that there is a problem in production of thyroid hormone. Let's say a scenario telling about a patient with hypothyroidism or hyperthyroidism. We can use a diagram as well. And then we ask the students to find out the consequences of decreased production of thyroxine to the abnormalities of the thyroid gland. So what would happen if that abnormality is there and thyroid hormones are not being produced. So what would happen to the person if they know the functions of the thyroxine? They would be able to come at least some symptoms and signs of hypothyroidism, or it can be hyperthyroidism, their sign and symptom. And the important, as I mentioned earlier as well, that the learning issues here are addressed in the same session. It is not like team-based, like problem-based learning, where when students go back and learn about those learning issues, it is, we try our best to address that issues there and then with minimal sort of homework, if at all, is there. Similarly, the third example can be a compartment syndrome, where the compartments are taught to the students in one session in the anatomy in detail, and then there is a trauma, and so what organs can be affected and what kind of sign and symptoms may be produced. So in this way, in one session, we teach them some information, and in second session, we ask them to apply that situation or apply that information in a clinical situation. Obviously, we are not expecting the perfect answers from the students, but I think there would be a lot of thinking, and they would generate the information, what could be the signs, what could be the symptoms, and then there could be discussion on that. But so what could be the pathophysiology of that particular sign or symptom? And here is that the lecturer may contribute the relevant information. So this is one method which we call the normal to abnormal approach. So in summary, the first session is a lecture or directed self-learning or assignment, for example, cardiac cycle. Second session is introduction of the case problem, for example, VSD. And then the questions are in other words, learning outcome, changes in hemodynamics, its symptoms, signs, complications, and it can be worked like we were talking in small groups, and then the discussion, and the facilitator guides the students, make any corrections if needed, and some questions for group or self-study on the spot can be given. So this is the first approach, normal to abnormal approach. Any questions about this approach before we go on to the second one?
Yes, Prof.
All right.
Meaning that just looking at the first session, so the lecturer or the facilitator delivers a lecture for how long in the first session?
Yeah, it is a normal lecture. It's a normal 1 hour lecture, for example. Yeah. So you cover that topic, and then in the second topic, you see that whatever you have taught, are students able to apply that in real world and real situation? It actually helps a lot that if they are able to apply, means they have understood the first part very clearly. And now other thing is that it's very, very relevant, means that we are bringing the integration between preclinical and clinical. Right?
Thank you. Yeah.
Yes. Any other questions?
Yes, sir.
Yes, please.
Yeah, does that mean we have to first taught the preclinical information to the student, then ask them about the clinical information, like the clinical features, diagnosis, and possible treatments?
Right.
That's so.
Sorry, can't hear you. You please unmute yourself. Yes.
Yeah, is that so? We have first to tell the students is the preclinical information, then ask them about the clinical information. Is that so?
Yes, please go on. Yeah.
Okay.
So,
Okay. I was asking about that. Okay.
right. Okay. Now,
Okay.
if you look at this this example that we have taught the cardiac cycle, the normal cardiac cycle, and then we say, hey, okay, now there is a hole in the interventricular septum, and you know that the pressure on the left side is more than the right side. So obviously the blood is moving from the left side to the right side, and from right side it's obviously going to the lungs. So just imagine, ask them, it would be an interesting puzzle for the students to see that with this the defect, what would happen to the flow of the blood. That would be the first task, and I'm sure the students would be really thrilled to work on that. Let's see what happens to the flow of blood. And then when there is this flow, what would happen to the volume, and what would happen to the oxygenation, and what would happen to the tissues when they are getting this mixed blood. So although it's not, they are not really making a diagnosis of VSD and treating it, but it gives them a very, very clear example that how what they have learned in physiology is going to be applied in clinical situation. And this, to me, it creates a lot of interest among the students. And so as we are saying, that they have to come only with the knowledge what they have learned in their first session, not necessarily extensive information. Yes, Dr. Aisha, please unmute yourself.
So I just wanted to know about the use of DSL as the preparatory session for CBL. In your experience, what is a better strategy? To have the students do it themselves in a DSL, or should a teacher be there to guide them?
Yes. Now, I think, Dr. Aisha, it depends what is your assessment of your students. Obviously, students would like to have lecture that somebody explains to them, but we can also, okay, take this 1 hour and all of you sit down and read about the normal cardiac cycle, and where the lecturer is there to answer that question. You can give them a homework rather than sitting in the class. Okay, tomorrow you come prepared with the normal cardiac cycle. But like you said previously, that some students may not comply with that. So at least to begin with, in the initial stages, lecture might be a better choice.
One question which is coming in my mind, sir, is
yes, Dr. Bach, please. Yes.
When the pre-clinical teacher is telling about the cardiac cycle,
Right.
So in the integrated modular system,
Right.
usually the same lecture is followed by the clinical teacher who comes to describe him about the VSD.
Right.
So in this system, you are telling the students everything about the cardiac cycle and making him that he should know about the clinical side before telling him the clinical teacher comes and he should tell him.
Yeah, in that situation, you may not need to call the clinical lecturer.
Yes, sir.
Yeah, so because the level of the student is not really at that level. The integration is there, of course, and the integration is not necessary that we should get lecturers from clinical side, but if you can get, that would be great. That would be great. But even I mean, because this is very simple thing, any medical based lecturer should be able to handle that.
What Dr. Aisha Abdullah is doing is here, sir. So probably she is doing very well, especially in PMC.
Right.
Because we all the clinical teachers are involved with the preclinical teacher at the same time.
No, that's great. That's great. That's very ideal situation.
Yeah.
Yeah, because the clinical lecturer can create even more interest in the situation because they can share their stories, their experiences in the clinical. So definitely that makes a lot of difference.
Okay, sir.
Thank you. All right, let's move on to the second, which is a modified essay questions. If you are not familiar with this modified essay question, actually I have shared one MEQ previously in the group just to make you familiar with that. So and you see that in that example, there is a progressive unfolding of information. So let's say in first part, you can show, and this is mainly for clinical, right? And then now students have to apply their previously acquired information, which is from both preclinical and clinical years. And then we gradually unfold the information and ask the students to discuss about that and sort out the problem. And the third, it's like CPC as well. Modified essay question is like a clinical pathological conference where there's a progressive disclosure of information. The history is provided, then the students make a differential diagnosis, and then the findings and results, etc. So this is the second approach, which we use quite often as well. Again, the lecturer has to come up with the MEQ, and actually it's not necessary to be a perfect MEQ. We don't prepare these questions and vet basically because this is a verbal. So the issues which happen in written format are taken care of very well. So I have done this many times using my old modified essay questions in the classroom and use them as a teaching method for case-based learning. In fact, we can use the same format if we are conducting a Viva examination, that we use an MEQ to conduct a Viva with progressive disclosure of information. The third is the case presentation, and which was asked previously, and I actually do this. Now, what happens is that in our case presentation sessions, which is in clinical year 3, year 4, year 5, we ask 3 or 4 student group to clerk a case. They clerk the case, they perform the physical examination, they look at what investigations have been done in the hospital and how the patient was managed in the hospital. And one of them would also look into the literature on the latest recommendation for that case. Now, these four students, they have come prepared, and then we have this case presentation in the classroom. So what we do is that the one student who is supposed to present the history, we ask them to give only the biodata and presenting complaint. They are not allowed to tell the history to the group, and the group members, let's say, as I said, my posting students are about 25. So sometimes I don't divide them in the groups. So the one student who has taken the history from the patient and he knows all the information, he is standing there, and rest of the class is taking history from this student. So everybody is encouraged to ask questions, and they have to ask relevant questions. And if there is, let's say, some question which is sort of odd question, the lecturer can ask the student to explain the reason why they are asking that question. Lecturer can also occasionally pick up some questions and ask the reason why that student is asking that question. It might take about, let's say, less than 10 minutes usually, that all the students would ask questions from that the presenter, and they would take a history. So by 5-6 minutes, they have taken all the history, and we follow the structure of the history. So first, they would be asking the a question related to the presenting complaints and the systemic review and other history. And once we have finished the history, the whole class would make a list of differential diagnosis. Right? Now, this is, then the next student comes that who is supposed to present the physical findings. That student would be asked to give only the basic information like vital signs and anthropometry. And the rest of the examination findings again would be asked by the other students, and again they have to ask the relevant whether liver is palpable or spleen is not palpable, and then they have to say why they want this information. And again, so it might take another 5 minutes that now we have all the history information and the physical findings. And at the end of physical findings, we can modify our list of differential diagnosis. And based on the physical examination, we would look at the differential diagnosis, whether we can delete some or we can add some. So in this way, we would have a list, and then once we have a list of differential diagnosis, then students have to ask the investigation results, which the presenting students would be answering. Those questions, again, students have to ask the irrelevant investigations, and so in this way. And then is the again would be the management option. So actually what management was done in the hospital and what alternate methods of management are available. Now, there was a question earlier that the lecturers have to present. Yes, they prepare. But in this case, the major work is done by the students and not by the lecturer. And because lecturer know the case beforehand, so they might have some let's say pictures or videos or some information about that which they can share with the students. But in this case, using case presentation as CBL mainly would be the work done by the students. The beauty of this is that this is a real case, all right? Remember, we were talking about that the case-based learning has to be a real case, and these are real cases which students have clocked from the wards. So all the data is real, all the information is real, and that fulfills the many aspects which are required in the case-based learning, the analysis of clinical information, analysis of laboratory results, making a diagnosis and management, etc. And during the process, some new things obviously would come in discussion. So this is the third method of conducting a case-based learning session. Right. Now, these are three methods. One is normal to abnormal. Second is modified essay question. And third is the case presentations. And actually, we here are practicing all of these. Even normal to abnormal are being done in clinical years. I know that our ENT lecturers, they teach about normal things first, and then they give a situation where students have to apply that knowledge. Now, I have some examples here to share with you, and these are the real example in the sense that which I have used in my sessions. The first is a case scenario. It's a 10-year-old boy, a known case of chronic rheumatic heart disease, presented to the pediatric clinic with a history of persistent fever, fatigue, and weight loss over the past 3 years. And then the child also complained of joint pain and had small painful nodules on his fingers and toes. And his parents reported that he had been experiencing night sweats, and they visited the family GP, who informed parents that the child has a heart murmur, which was not there before this illness. So if you see, this scenario has a lot of information. Here, it's a known case of chronic rheumatic heart disease and presents with fever, fatigue, weight loss, and then these nodules. So again, there could be discussion, what are these nodules and what is the importance of their presentation. And then is the other symptoms of night sweats and detection of new heart murmur. So that generates a lot of discussion. Obviously, the lecturer have to prepare material for this. Another example is a 4-year-old boy named Alex presents to the pediatric clinic with a high fever lasting for 5 days, unresponsive to antipyretics. And the parents report that he has been unusually irritable and has developed a rash on his torso and limbs. And then on examination, Alex has bilateral conjunctival injection without exudate, cracked lips, a strawberry tongue, and swollen and erythematous hands and feet. And his cervical lymph nodes are also enlarged. And to emphasize these findings, I used these pictures, let's say, to show, for example, the conjunctivitis, to show the rash, to show the redness, and to show the cracked lips and the rash again, and to show the swollen hands and feet. So in this way, the whole session is conducted, where as a facilitator, I simply guide the students, and they work on that, and they are allowed to look at, because they all have access to internet and the scientific sites, so they can look for information if it's needed. At the same time, I contribute wherever they are stuck, right? So this is the example which we practically are using. Here is another one, a complete session on failure to thrive. So, and these are the learning outcomes that by going through the process of solving this case, the participants will be able to define the term failure to thrive, list the causes of failure to thrive in children, discuss relevant points in history taking and physical examination in a child with failure to thrive, describe relevant investigation expected results to make diagnosis of failure to thrive and to plan its management, and discuss management. You see here, it's you can say there are so many learning outcomes, but because this case is simple enough and we feel that it can be solved in the 2 hours, so we have that learning outcome, but each one is very, very clear, clearly stated. Now, we start with this picture and then ask the students to identify the abnormal features visible in this photograph. So they would look at let's say, the muscle wasting, the ribs being prominent, the eyes being prominent, and the abdominal distension, for example. And then we give the history that this is a 10-month-old. His date of birth is 1st of April, although the EDD was 1st June, so it's a preterm, so they have to interpret this information. that this is a preterm delivery, and then they have to collect the corrected age. So concept of corrected age is there. And then we give information about the birth weight and the anthropometry, and then they are supposed to draw this information on the percentile charts and interpret it. Right, so every student is working on that, and then obviously they have to answer, justify your answered, and likely causes of failure to thrive in this particular child, apart from other, and likely impact of failure to thrive on growth and development of this child. And then we have this what information to gather and what to look for, and investigation and their interpretation, and then 10 principles of management, which we would summarize at the end. And in this way, this is a case-based learning session completed on this topic of failure to thrive. Right, so these are practical examples. Now, if there are any questions or comments, I think we'll be happy to discuss here before we go on the hands-on activity. Yes, please.
Yes, Prof. A small question regarding, the session the case-based learning session may be 2 hours.
Right.
But I think for the preparation of like designing the case base,
Right.
that may take a longer duration. I mean, to prepare that, and of course, if you have renal case scenario, which is easier, but of course, sometimes it's more.
Which approach you are talking about?
Maybe the normal to abnormal.
All right. Yeah. Actually, because the normal to abnormal, the first session is usual session, which you would normally take in let's say physiology. You would normally teach the cardiac cycle, which is your normal session, maybe a 1 hour lecture or so. And the other would be the maximum time we give is 2 hours. But it also depends upon the number of students. If number of students is smaller, that might take lesser time. But we have to plan, as I mentioned earlier, that this is the job of the facilitator to organize the discussion and monitor the discussion in such a way that it doesn't spill over the time. Right. Any other questions? Yes, Dr. Shazia, please. Yeah, Dr. Shazia, you have any question?
Sir, I have one question.
Okay, Dr. Hamse, yes, please.
What are the common pitfalls during case-based presentations?
Sorry?
What are the common pitfalls during case presentations?
Oh, okay. Now, the students prepare the case, and usually lecturer would have a very short meeting with the students about that. Sometimes these students they send us the case information in form of slides and ask our comments. So if there are any issues in that, the lecturer would sort it before it is presented to the class. And the other thing is, because students know that the whole class would be asking questions to them, they come very well prepared because they don't want to embarrass themselves in front of every class that somebody asks a relevant question and they don't know about it. So it actually, I think it's a positive pressure on the presenters to come very well prepared. And because again, they would be given some marks on their presentation, so that also contributes to their continuous assessment. So usually they would be very careful about it. We encourage them to bring some pictures as well with the permission of the patient, as especially if, for example, there is some kind of rash. We also get the real investigation results, even the radiological, for example, there is an X-ray or CT scan. So the good thing, as I said, in that is that everything is real, not something which is made up. So that creates a lot of interest. And sometimes then you discuss there is a diagnosis which may be different than what you have thought about it, and then you discuss about the pros and cons on that. Actually, if you see, this becomes a very interesting session. Normally, if we ask them to present the history, physical examination, and management, I'm sure half of the class is sleeping. And because in that case, only those who are presenting are ready with the presentation. But here, because the lecturer is there and then is encouraging students to ask questions, so everybody is taking part in that discussion. So it becomes really very active session. Any other comments or questions? Okay, now, if no more questions, I see here about 30 participants, so we can actually make, let's say, 5 groups of 6 participants each. And let's say what task we want to achieve is here is the so now each group first has to identify a learning outcomes and accordingly a case or a topic, or you can reverse as well. You have a topic and then you identify the learning outcomes. And then you have to develop a scenario. You can also search the internet and maybe pick up a video or a pictures on that. Identify the task based on the learning outcomes, the diagnosis, prevention, etc. So you can have one of the 3. Either is the normal to abnormal, or MEQ, or the case presentation style. So it's your choice, each group's choice. And I think we would have about half an hour for each group to work on this. And then we come back and we will request each group to present, and then we would have discussion on that. So for presentation, each group should identify their spokesperson. So, and in the meantime, if you have any question, I think I'll be around and will be able to answer in that. Is that clear to everybody, the task?
Yes, sir.
Okay, now I will divide the participants into the 5 groups, all right? And then you please join your respective breakout rooms. So welcome back. Everybody enjoyed the session, I hope. So let's start with the presentation. Which group volunteers to be the first presenter? Any volunteer? Okay, Dr. Badr Murtaza, which is your group? Please unmute yourself.
Yes. Assalamu alaikum, sir. My group is group 2.
Yeah, okay. You can share your
How would I be able to share my presentation onto the
if
group?
you go to this, there's a green button, share at the bottom.
Yes.
You click that.
Yes.
And then you will see your presentation. You just click that.
Yes.
All right.
Is it visible now?
Yes, we can see renal calculus disease.
Yes, sir.
Right.
Yes. This was a work done by our group 2 in which we were talking about the renal calculus disease. The main learning.
Yeah, please.
Yes.
Yeah,
The learning objectives for the students were that they would be able to appreciate the etiology of renal calculus disease and the diagnosis, how to diagnose a case of renal calculus disease on the basis of history, clinical examination, and investigations.
Okay.
What we made a clinical scenario of a 30-year-old male who presented with pain in the right lumbar region. It was radiating from right loin to groin and accompanied by nausea and vomiting. It was sudden in onset and severe in intensity. He had also been experiencing similar bouts of pain for the last 10 to 15 years. The main point behind this scenario was regarding the etiology. We added the history for 10 to 15 years so that he had been experiencing this problem since his early ages. To taking this etiology into the factors going for the congenital part and the other metabolic factors that could lead to this stone formation. So when we went on to the questions and those which we can ask, especially to achieve our learning objectives, that what questions are the students going to ask to the patient regarding the past history, the fluid intake, the dietary intake of the patient, his family history of stone disease, the socioeconomic history from where he's coming from. We talked about dietary and the personal history. And going for the diagnosis of the disease, what are the associated symptoms? Symptoms, is he having any evidence of infection or any renal failure? Details of the urine and its output and its clinical symptoms. Now, from the clinical examination point of view, whether the patient is having any evidence of infection, his vital signs, also examination of the kidney, whether his stones had led to the formation of any renal abscess or infected kidney, that has to be found out. And for the diagnostic investigations, he would be requiring a complete blood count, urine analysis, an ultrasound, renal profile, and a plain CT scan. So with this whole event, we have prepared the case of making a learning objectives. We're going to make an introduction regarding this thing, and then making the group work in our CBL2. We're going to make this problem solving ability with discussion. And in the end, we're going to go back to the feedback and reflection. We're going to assess it with a couple of MCQs or few quizzes, and we can even give the students a chance to give their self-assessment or their reflection.
Right. Thank you, Dr. Badr Murtaza. Okay, the floor is open for questions. Please ask your questions or comments about it. Anybody has any question or comments on this?
The students who is on the preclinical sides while narrating this whole story, because we are coming from that sides now. So how you will mention the whole renal system pathology, at which side he will be focusing more in the renal system?
As far as in the CBL1, we will be discussing the aspects of etiology and the pathogenesis. And in the CBL2, it's basically going to be the clinical aspects which are going to be correlated with this baseline knowledge of these students. And from history and exam history, clinical history, past history, and all those things, then we can go for the etiology of the renal calculus disease.
Actually, Dr. Badr, when you made this scenario, which year you are thinking? So which
This is
year of
based,
students you think would be able to handle this?
this is the final year students.
Yeah, so it's a final year students, right? Okay, so for clinical side, yes, okay.
Yes.
Right. So any other questions? So just look at it with the perspective that this is for final year undergraduate medical students.
Sir,
Then it's okay.
yes, sir.
Yeah. Okay, Dr.
Sir, it
Shazia.
can, yes, sir.
Yeah.
I just want to add that it can also be applied, don't you think, that to the preclinical classes? Third year even is well acquainted with taking the history and understanding the investigations and basic aspects of the history taking. So can it not, why can we not apply it to the third year or even the second year after completely understanding the physiology of renal systems? So I think with little help and guidance, can we not apply that to the preclinical years also?
Dr. Badr Murtaza, you would like to answer, or any member of the group would like to answer that?
Well, she's from my group.
I see.
Well, a point.
Okay.
Well,
We'll come back to that. We'll come back to that. Let's see what other people have to say. Yeah, such an interesting scenario. Anybody want to comment? Okay.
Yes.
Yes. Yes, Dr.
Yes, bro.
Imtiaz. Yes, please.
I'll just comment, I mean, a bit on the working on the differential diagnosis. You know,
Right.
it looks like a very straightforward. But the differential diagnosis will, of course, let people think a bit outside the box and the possibilities in case we don't find adrenal calculi even on that. So it's good to keep some.
Okay. Right. Now, the first thing out of those three options, normal, abnormal, case presentation, and MEQ, which you think is the most suitable format for this?
So it can be normal to abnormal as well as the subsequent disclosure of the cases. Both
That means MEQ.
MEQ, yes, sir.
Yeah. Okay. Yeah, I think it makes a really very good MEQ if you can put this information in that format. Please, after this, you can look at the example I sent to you.
Yes,
for MEQ, and
yes,
then
sir,
you can break this information into different components and
yes,
put it in that format. And
yes.
now the other thing would be that for each part, you give the information and you ask the relevant questions. And then the second is that you provide certain information. For example, in part 1, you might ask that what physical findings you would look for.
Yes, sir.
And in part 2, you can tell the physical findings and ask them to interpret.
Yes.
Fine.
Yeah, and then after interpreting the physical finding, you can ask that what investigations would you do?
Yes.
And in part 3, you can give the results of investigation and ask them to interpret.
Yes.
And then the last part, you can say that based on this, we have made this diagnosis. So what would be the principles of management? So in this way, it would be excellent exercise that you are providing the pieces of information sequentially. First, you ask them to think about it, then you provide the right answer, and then you ask them to interpret. So it would be very interactive session, and this can make a really good MEQ kind of case-based learning.
Yes.
You just follow the example which I have sent to you, and just put this information in that perspective. I think that would be an excellent exercise.
So
Yes, sir.
that's fine.
Yeah. Anybody has any other comment on this?
Sir, I just want to know that as you have told that this can be put into other modified essay questions pattern. So I think we can practice this in first or second year preclinical classes as well.
I personally, I think it's too advanced for them, because you are doing a lot of clinical things there.
No, sir, in CBL one session, if we discuss a bit clinical aspect of the subject, then we can make it simple or easier, like related to some basic concepts.
Yes, you let's say you can talk about renal functions, the structure of the kidney. Yeah, then you have to modify it accordingly. But if, for example, you are doing for year 5,
yes, sir,
you don't need to ask them to prepare anything, because
yes, sir,
by that time they have already covered most of it.
Yes.
And in year 5, so major work would be by the facilitator, that you formulate this question, and maybe when you are asking some investigation or CT scan or other, you can have pictures and show them that this is this is the CT scan result, or this is the KUB, or this is the ultrasound, and so you can really make really make an interactive session.
Even showing them the laboratory reports of the complete blood count and the renal function test would also add a good addition, generate a good discussion.
That would generate really good discussion. And then there would be, you can ask in between some provoking questions as well. So the purpose is that everybody in the group would be really actively participating.
Fine, that's fine.
Right. Okay.
Thank you.
Excellent work, group 2. Right. Who is next? Next volunteer. Okay, Dr. Muhammad Harun. Dr. Muhammad Harun, you want to say something? Okay, next group.
Sir, if it's okay, we would like to present group 1.
Great. Okay. Dr. Laiba? Yes, Dr. Laiba, group 1. Please, Dr. Murtaza has already stopped sharing, so you can share.
Okay, sir. Please, thank you.
Okay, you can blower on the side, so you set the vacuum on.
So is it visible?
Yes, case presentation, yes.
Okay. So, sir, we chose case presentation, and the topic we chose was pulmonary embolism.
Okay.
So, we would first put out the learning outcomes for the students of 4th year MBBS.
Right.
These would be the learning outcomes, differentiating between different types of chest pain, identifying the signs and symptoms, listing the common risk factors of PE, assessing clinical probability scoring, describing the diagnostic tests, describing the first-line treatment, and identifying the complications.
Right.
So in CBL1, we would start with a lecture on pulmonary embolism.
So this is for year 4.
Yes, this is for year 4.
Okay.
Okay. So in CBL1, we would have a lecture on pulmonary embolism. And in CBL2, we would give them with a case scenario. So this would be the case scenario.
Right.
This is actually a real case shared by Dr. Imtiaz. And the case is that a 70-year-old woman came with chest pain and increasing breathlessness for past few days. She has noticed that her breathlessness is becoming more severe with each passing day. The chest pains have been constant and worsening with breathing and coughing. The patient is chair-bound for 5 days, and the vital signs show tachycardia and oxygen saturation of 85%.
Okay.
The respiratory exam showed rapid and shallow breathing, and the cardiovascular exam showed tachycardia and hypertension.
Okay.
So starting with the case scenario, we would open up the stage and the students will discuss the clinical presentations, starting with the history and then the clinical presentations, and then they'll move on to examination and investigations, and then they'll come up with a differential diagnosis. There could be multiple differential diagnoses like angina or pneumonia or pneumothorax and even pulmonary embolism. And then they'll confirm a diagnosis, and then they'll work on their clinical probability scoring and management. And then finally, we'll give the feedback.
Right. Okay, good. So any views from the other participants? Can you show the first slide, please?
Yes, sir.
All right. So any comments, views from others?
I just wanted to ask, is there any limit to the number of learning outcomes, or we can have as many as we want?
No, really there is a limit because you have only 2 hours. So you have to assess whether the learning outcomes you are aiming are achievable within 2 hours. Because if you put up the learning outcomes and then you don't talk about it, the students feel very bad about it. So we should have the learning outcomes and we must achieve those learning outcomes within those 2-hour session. Okay, any other comments, questions? What format you think is it? This session, whether it's normal to abnormal or it's MEQ or it is case presentation?
So I think this is an MEQ because we are adding on the information. We'll start with the basics and then we add on
right.
with each question.
Yeah, yeah, it looks like that, right? The other is that if we are talking about year 4 or year 5, you may not conduct a special session for this. I mean, you would teach pulmonary embolism as a routine, and then subsequently, let's say you have that session in the beginning of week or the previous week, and then you put up this session, right? So in clinical years, because they would be learning these things anyway, so it's not necessary that you have to have a session first, right? But then you share the learning outcomes with the students, so they would know that what kind of discussion is going to take place. What I'm trying to say is that it's not necessary for you to do these 2 sessions in that sequence. There may be interval in between, because during the clinical posting, they are learning so many things here and there. And the other is that when we are putting up the scenario, and because we want the list of differential diagnosis, so can you show the second slide, please? So the information should be broad. To next one, please. The the scenario where you have given the scenario. Yeah, here. So to begin with, you may not make it so specific. Initially give a broad, let's say, chest pain and some findings, and then ask them what history would you take, or otherwise you can say what do you think are the possible causes, and then for each cause, how would you take the history? And again, you can provide the information in the subsequent part. So again, it would make a really good MEQ with the results being provided. For example, you can ask them to discuss about the oxygen saturation. Similarly, the breathlessness or chest pain. So you can, again, it's put it in that format that bits of information are given over time, and the questions are formulated according to that. For example, if we say a 70-year-old woman came with chest pain and increasing breathlessness for a few days, and she was noticed that her breathlessness is becoming more severe with each passing day. And the chest pain have been constant and worsening with breathing for coughing. And let's say if we stop there, and or maybe up to the patient is chair bound for 5 days, and then we ask questions there. And that would be relating to history and differential diagnosis. Then we go on to the part 2, and there we give the physical findings like vital signs, oxygen saturation, respiratory examination, and then ask them to interpret these findings, and then asking about the like the previous one, asking them investigation and results. So in that way, it can really make a good MEQ type of case-based learning. Anybody has any other question or comment?
So, Prof, I'm from the same group. So, just to recap whatever you said, so I can put part 1 where there's only the clinical investigation,
right,
and the part 2 where we add up the findings on clinical findings, maybe, and part 3 maybe with the investigation and so on.
Yeah.
Okay.
You see, Dr. Imtiaz, the advantage of that is that then everything is very focused. Student would be very clear, okay, this page or this part, we are talking about history taking. Next page, we are looking at the physical finding and interpretation. So their focus would be on the real thing. They would not be wandering around. And that can make a really, like, first one, it would be excellent discussion among the students.
Okay,
Great.
thank you.
Great.
Yeah.
Any other comments by anybody else? Okay, can we move to group 3, please?
We would like to present. We are group 4.
Oh, okay. So, yeah, please. Just share your. Okay. So this is.
This is.
Sorry. How should I pronounce you, Dr. Hamse? How do you pronounce your name?
Dr. Hamza. Yeah.
Oh, Dr. Hamza. Right.
No.
Okay. Yeah. Hazma Muhammad. Yeah. Hamza Muhammad. Okay. Can you make it a bit bigger so that easy to read? Yeah.
Yes, sir. We are group 4. We would like to present.
Okay, group 4. Okay.
Yeah. We would like to present our activity as a case-based approach on case-based learning.
Okay.
The topic we have chosen is asthma as a case presentation.
Okay.
As an introduction, we will explore a case study on asthma, a common chronic respiratory condition The activity is designed to help you understand asthma as a key clinical aspect, triggers, and management strategies. The learning outcomes are third-year medical students will be able to understand the pathophysiology of asthma, identify the triggers and risk factors for asthma, diagnose asthma based on clinical presentation and investigations, and also to formulate a management plan for asthma, including pharmacological and non-pharmacological strategies. Okay. We have chosen a case, a 15 years old patient who has been experiencing recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. These symptoms tend to worsen at night and early in the morning. The patient had a full history of allergies and reports exposure, dust, and pollen. This is a classic case of asthma presentation with a patient with a previous family history and also previous episodes of asthma. So this would be an asthma exacerbation case. So the task is based on the learning outcomes. These are the important questions, for example, to diagnose the condition based on the patient's clinical presentation. So in most our hospital settings, asthma is a clinical diagnosis, and usually we don't need, unless it is in the first presentation or the patient is very young, we don't need any other extra measures. Okay, number 2 is to identify potential triggers for asthma. In this case, develop an effective management plan, including treatment and prevention strategies, and also educate the patient on asthma management and how to avoid triggers. So our guiding question would be, what are the clinical features and investigations confirming the diagnosis of asthma in this case? So it is very obvious in this case. What are the most likely triggers for this patient's asthma? And how should this patient's asthma be managed in the short term and also in the long term condition? The next page is how to conduct the session. We usually divide the participants into small teams. Each team will review the case details and discuss their responses to their guiding questions. Each team should prepare a brief presentation summarizing their findings. Nominate one spokesperson, as in our case, per team, to present their conclusions to the group, and also to facilitate an open discussion to compare solutions and refine the overall understanding for asthma management. This is all. Thank you very much. We can have the questions.
Thank you, Dr. Hamza. Any questions from the participants? Okay, Dr. Hamza, in this class, how many students are there?
We have based it in our setting, so usually between 25 and 30 students.
25 and?
30 students.
30, 20. So, so this is a medical posting. Is it medical posting?
Yes, sir. It's a medical posting.
And 25 students, 25.
Yes, 25, yes.
All right. Okay. Yeah, actually, if you try, you may not need to divide them into small groups. If, let's say, remember the case presentation, as you said, you want to do the case presentation, you can choose 3 or 4 students, ask them to clerk and examine a case of asthma.
Okay.
Right. And then they come to the classroom, and let's say the whole 25 students are sitting there. And the first student gives the, let's say, the biodata, that the 15-year, and it presents with, let's say, respiratory difficulty or noisy breathing. And then you ask the students to take history from him. So, and then because your guidance is there that they should find, for example, the triggers. So students should be asking in the history to identify what are the triggers there. So it can be actually a very good case presentation if you follow in the in the PowerPoint which I sent to you, the case presentation part. So let's say 3 or 4 students would be the presenters, and rest of the class can ask the questions. So let's say one student presents with biodata and presenting complaints, and then answer the questions related to the history. And the second student can who has done the physical examination can answer the questions related to physical findings. And the third student, if, for example, there's some investigation done, let's say if they have done X-ray or they have done arterial blood gas or any respiratory functions, so they can talk about that. And fourth can talk about what management was done in the hospital and what else can be done. So in third year, I think this is very, very suitable case for year 3 because asthma is so common. And you are relying on history, physical examination. As you said, the asthma is mainly clinical diagnosis. So it can make a very good case-based learning session in terms of case presentation. So if you can put this information in the sequence, you just look at the PowerPoint I sent to you and the case presentation session, and then you can format it in that way, and that can be a great CBL session with the students. I'm sure they would enjoy that because when you ask them to ask questions, so they have to think what questions they are going to ask. Sometimes I even ask them not to use the technical language or medical language. You use the language in which you talk to the patient. So they ask the question as if they are taking history from a real patient using the common language. So that can make really a good session, a case-based learning session for year 3 students.
Okay, sir. Thank you.
Yeah. Right. Anybody has any other views? Please share. Seems people are very quiet. Any of the postgraduate students from Peshawar Medical College? Okay, so we have done group 1, group 2, and group 4. Let's move on to group 3.
Assalamu alaikum.
Walaikum assalam. Sayyid Muhammad Hamza.
Yes, sir.
Yes, please share your slides or screen.
All right, sir.
It's group 3. You are in group 3.
Yes, sir. I'm not sure if my group was group 3, but our presentation is yet pending.
Okay. Okay, it's fine.
Yes, sir.
Mm.
So the topic we chose.
We will call it Dr. Hamza's group.
No,
Yes.
it's group 5, Doctor. Our group is group 5. I am in the same group.
Group 5. Okay.
Yes, group 5.
Yes, sir. So the topic we chose for our presentation is ischemic stroke.
Right.
And it is directed at final year medical students.
Okay.
We started with the clinical scenario, which
Can
is.
you share the screen? Have you written?
Yes, sir. Is my screen not shared? All right.
Oh, yes. Please. Yes.
All
Okay.
right.
All right. Okay.
So I'm going to start now.
It is for final year students.
Yes, sir.
Okay.
So we start with the clinical scenario. A 50-year-old male patient, Salim, presented to the emergency department with in the early hours of morning with onset of right-sided weakness and slurred speech for the past 3 hours. He is a known hypertensive, not compliant with his medications.
Right.
Then
Okay.
the questions I'm going to pose at my students is that when did the symptoms begin? What was the patient doing when the symptoms developed? Since he is a known hypertensive, since when is he a known hypertensive? Did he miss any last doses of his medications? Does he have any other comorbidities like epilepsy, migraines, and diabetes, etc.?
So you are asking them to take history.
Yes. What points in the history would they like to ask from the patient?
All right. Okay, good.
Then I'm going to ask them, what examinations are you going to perform? And which will include blood pressure, the GCS, the general physical examination, respiratory rate, neurological examination, which includes motor assessment and reflexes. I'm going to then ask them what investigations they have in their minds, which should include CBC, RBS, and the CT brain. Followed by my scenario continues again. On examination, his blood pressure is 180 over 100. His RBS is 120 milligrams per deciliter. The right plantar reflexes are going up. The knee jerk reflex is exaggerated with the power of 2 by 5 in the right upper and lower limbs. His left upper and lower limb power is 5 over 5 with normal reflexes. Then I'm going to ask them, what do they think the patient is suffering from? It can be an ischemic stroke, it can be a hemorrhagic stroke, it can be subarachnoid hemorrhage, it can be hemiplegic migraines, it can be TORS paralysis. So I'm going to encourage them to come up with any number of differentials they can. And then I'm going to ask them how to narrow down the list of differentials, which should include the history, examination, and investigations. The scenario further continues like an urgent CT brain was done, which ruled out intracerebral hemorrhage. A CTPA, CT perfusion angiogram, showed ischemia in the MCA territory. And the ruling out differentials part, I'm going to ask them, now that the CT brain has been done, it is going to rule out hemorrhagic stroke and subarachnoid hemorrhage. And the history is going to not point towards subarachnoid hemorrhage, as it does not have severe thunderclap headache. Patient has no history of migraines, so it is unlikely to be a hemiplegic migraine. Patient has no prior history of epilepsy, so unlikely TORS paralysis. So scenario further continues. Salim was admitted to the stroke unit and underwent a successful thrombolysis, following which his symptoms resolved. He was discharged 3 days later with a regular follow-up plan with the physical rehabilitation team and advised to comply with his medications. The
Right.
learning objectives
Mhm.
for this presentation were to understand the types of strokes and conditions which mimic stroke, correlate the symptoms to cerebral dominance on the basis of speech deficits, as we know that dominant area has the speech area, and if there is a dominant area infarct, it is going to lead to slurred speech. I'm going to make them revise and recall the blood supply of different areas of brain and correlate with the symptoms, such as anterior cerebral artery infarcts are going to cause major deficits in the lower limb rather than the upper limbs, and the MCA territory infarct are going to cause hemiplegias, and the posterior circulation is going to lead to diplopia and vision problems. Then I'm going to ask them to list causes of stroke, ischemic stroke causes, and then discuss management of stroke, both within and out of the window period. The learning objective also is going to encompass the window period, which is 4.5 to 6 hours, and first line remedies in the window period, and out of the window period, we have the secondary prevention strategies, which include antiplatelet drugs. Sorry. Yes, sir. So this is what we came up with.
Okay, I think you have come up with an excellent MEQ. Simply you need to put that information in proper format. So part 1, part 2, part 3, part 4, where you are slowly disclosing the information subsequently, and then dividing the questions based on that.
Yes, sir.
Yeah, so let's say first part is history, and then the students asking history. In part 2, you can answer some of those questions, and then the physics. I think this can make quite elaborate. Maybe it's a for final year students would be quite an interesting challenge and practical thing. So it would fit very nicely in MEQ format.
Yes, sir.
Yeah, it would not be the case presentation or normal to abnormal, but it would be an MEQ format. Dr. Hamza, do you use MEQs for your examination?
No, I have not used an MEQ.
Yeah.
Because I am a basic sciences teacher. I teach anatomy.
But you have done such, I thought you have taught us a lot about the stroke.
Thank you, sir.
At least I have learned something new.
Thank you, sir.
Yeah. So this would be for let's say final year students would be a very good the MEQ, and maybe you can collaborate with some of your colleagues in final year, and because I have given you the format, the example of MEQ, and you can put it and maybe not in exam, maybe in some sort of continuous assessment, you can try and give it to the student and see how they perform. And the real teaching would be that when you discuss with them part by part. These are the questions we would ask and why we want to ask those questions, and what are the physical findings we should be looking for, and how the physical results are examination. For example, you said the lower limb involvement would indicate which part of the brain is involved, speech is involved, which part of the brain is involved. So you are really integrating very nicely the basic sciences, let's say anatomy, with the clinical picture. So I'm sure this would be an exciting session, especially when students know that they are not being examined. It's an open discussion session, and let them come up and discuss them openly. I think you need to simply put it in proper format to make it a real MEQ.
All right, sir. Thank you very much.
Great, great. Okay, I think one more group is left. So the final one, group 3 is left, is it? Yes. 1, 2, 4, and 5 done. Group 3 is left. Anybody from group 3? Oh, group 3 is absent. Is it?
No.
Should we?
Memuna has presented. She is presenting it, sir.
Okay. I thought we are going to mark you absent.
No. She is presented now.
Oh, okay. Okay, please share your slides. Yeah, I know we are going a bit beyond the time. It's already 5 o'clock, but we will discuss this before we conclude the session.
Mm-hmm.
We are unable to share the slides for some reason.
Oh, okay. Why is that? Because Dr. Hamza has already stopped sharing.
Can I share it in the WhatsApp group and somebody else can share it?
Okay, okay. Please send it in the group.
I've sent it, sir.
Is this your one?
Yes. Yes, this is one, sir. But
Right.
she has
Okay.
unmute herself.
All right. Okay. Can you see it on the screen?
Yes, sir. I have
Yes.
it here on my laptop.
No, yes.
Okay. Oh, yeah, I have shared it. So,
Sir, so this is a topic for the second year MBBS anatomy.
okay.
There's going to be a first session on this CBL about descending tracts it's going to be an LGF, and in the second section there's going to be an understanding of this descending tracts through clinical cases.
Okay.
So I'll start with a case presentation of a 55-year-old man presenting to emergency with presenting emergency department with progressive weakness in the right leg and difficulty in walking. And he reports a fall 3 days ago, but denies any head injury or loss of consciousness. And then his wife mentions that he has slurred speech and seems to have a difficulty using his right hand. So then I'm going to share the examination findings. Motor functions, the students are going to find out what are the motor functions that are the same: right upper and lower limb weakness, and the power is 3/5. The left side strength is normal. The reflexes are hyperreflexia on the right side, positive Babinski on the right, and sensations are all intact. In the cranial nerves, he has slight deviation of tongue to the left side, and he's mildly clumsy on the right side. Then there's going to be guided discussion questions. Students have to identify the track involved. What are the key motor findings? Which descending track is responsible for this? And why is the weakness affecting only the right side? The second is going to be localization of the lesion. Given that the ipsilateral cranial nerve and contralateral limb weakness, why is it likely? And could it be a spinal cord lesion? Why and why not? And then there's going to be there's an understanding of descending tracts. So they have to trace it, the corticospinal tracts to the cerebral cortex to the spinal cord. This is going to be activity. And then I have to answer these questions: that why they have hyperreflexia and positive Babinski. For clinicals, they have to say that what are the other signs that may develop if the lesion worsens, and how would a lesion in internal capsule different from this case, because obviously they would have studied it, and what investigation should be done. And then there's going to be an expected diagnosis and interactive activities like pathway mapping exercise and find the lesion challenges.
Right. Okay. So which year you think this would be appropriate?
Sir, second year MBBS.
Second year, right. Yeah, that's what I thought. So you would have CBL1, where you would teach this about these tracts and their clinical application, and then the CBL2 would be this presentation. Is that what you are planning?
Yes, sir. Yes, sir.
Yes.
Yeah, I think that's a very good example. Very, very good example. That in the first session you teach about, let's say, anatomy of this tract and maybe their functions and what can happen if there is a problem, and then you ask the students to apply that information in the second session. That you inform them that there's a lesion, and so what could be the effect if lesion at different levels, and what could be the possible clinical consequences of that. So I think with a little bit polishing, this could be really a good. This is a good example of normal to abnormal presentation for year 2 students. Yes, any comments from the other participants? Any other group member want to mention anything? Otherwise, today we have the presentations, and they cover all the three. So this is normal to abnormal. Then we have this case presentation, and then the I think Dr. Hamse was the good case presentation, and then we have a couple of examples of MEQ. So the good thing about this group work is that we have covered all the three you see the formats of the case-based learning. All right. Any questions? Anybody has any questions or comments?
Prof, I've got a small question.
Yes,
like
please.
we took some time today to prepare this case base before that. So before the session with the student is 2 hours. That's one thing. I mean, this preparation will take another like minimum 1 hour.
Right.
So when I mean, sometimes it may even take 2 hours. So total duration of the work will be like 4 hours.
Right.
So
In that case,
does.
Dr. Imtiaz, you have to limit your learning objectives. So, like in this case, the last one, we are going quite into the details. So,
yes,
because we know that we cannot go on and on and on. We have to. So we should give sufficient time. Sufficient time for students to think and work on it. Like this, the last one, maybe I think there was enough material to do 2 case-based learning sessions. So
yeah, that's what I was thinking.
Yeah, so much information. So it is very important that we plan in such a way that we finish within the time. Otherwise, students would be really, really upset about it. That and it may be too sort of stress for them. So because we want to make these sessions lively, we want to make them interactive, and the interactive sessions take some time. You ask questions, students answer. They have to think about it, then you have to do discussion. So you need to give ample time. This means that we need to control the number of the learning outcomes. So if we have so many learning outcomes, then we identify that which are the most important learning outcomes. Or let's say if I have 6 and I think I can do only 3. So I should choose the 3 most important learning outcomes from that and work around that, because in this, like this one, normal to abnormal, the lecturer needs to do a lot of work on these things, because you need to prepare material to show them as well. Right?
Yes, good.
Yeah, I know sometimes we can become very ambitious, but we should look at the time as well.
Prof, one additional question based on that one. How
Right.
many case-based session you can do in 1 week? I mean, is there a limit for that? Because I've seen my colleagues doing too many. The students, they are overwhelmed.
I think the limit is feasibility, because you have to do other things as well, right? So the one teaching learning method may not be cover everything, and not everything can be presented in case-based learning. So I think feasibility may be one, or I mean, we have in our timetable, I think about 2 CBL sessions, because we have TBL as well and other sessions as well. So the maybe 2 per week, but it all depends upon what kind of curriculum you have and what is the feasibility. It would, if we talk about clinical, so I think the more session in year 5 would help students a lot to prepare for their exam. So it would be more useful for them as well. And if you are using MEQ like we are using in our exam MEQ, so it helps students to prepare for their MEQ type of examination as well. Right? Any other comments? Thank you very much, everybody.
Thank you.
I hope it was of some use to you. Looking at the time, it's already 3 hours and 15 minutes. We have been in this, and I hope this time spent is worth spending. And there are a couple of things that we will maintain this group for a while, because I will try to edit this video and share in the group. In the meantime, you can have networking in your group, because we have people from different places, and the different specialties. We have people from Iran, we have people from Somalia, we have people from Bangladesh, from India, Pakistan. So it would be a good forum for your networking as well. So please utilize that opportunity, and stay in this group till I share the video recording of this session.
Thank you very much, sir.
Thank you. With that, I thank everybody,
Thank you,
and
sir.
hope to see you,
Thank you.
again.
Thank you, sir.
Thank you so much,
in
sir.
some coming up sessions, inshallah. Okay. Bye-bye.
You learned a
Thank
lot.
you. Thank you so much, sir, for
Thank you.
detailed. Allah Hafiz.
Allah Hafiz.